Why do some people get chilblains while others don't? It's a question that's probably been nagging at you since we first introduced the term chilblains, and it's a valid one. So let's delve a little deeper into the causes of this condition. Chilblains, also known as Pernio, are small, itchy swellings on the skin that occur as a reaction to cold temperatures. They most often affect the body's extremities such as the toes, fingers, heels, ears, and nose. But what makes some people more susceptible to this condition than others? The answer lies in the fact that chilblains are more common in people with poor circulation. This is because blood vessels in the skin constrict, or narrow, in response to the cold. When the skin is suddenly rewarmed, these constricted blood vessels can't always keep up, leading to a leakage of blood into the surrounding tissue and resulting in the characteristic symptoms of chilblains: redness, swelling, itching, and inflammation. Cold weather plays a pivotal role in the development of chilblains. Prolonged exposure to cold, damp, or drafty conditions can cause the skin to become cold, leading to the constriction of the small blood vessels. It's not just about the cold though. Poor heating can also be a contributing factor. Rapid rewarming of cold skin can cause a shock to the system, leading to the development of chilblains. So if you're someone who feels the cold more than others, or if you have a condition that affects your circulation such as diabetes or Raynaud's disease, you may be more likely to develop chilblains. Age can also be a factor, with children and the elderly being particularly susceptible due to their less efficient circulatory systems. But remember, while we can't control the weather, we can control how we respond to it. And understanding the causes of chilblains is the first step in doing just that. But don't worry, there are ways to prevent chilblains, and we'll get into those in our next segment, so stay tuned. Prevention is always better than cure, right? So how can we prevent chilblains? Let's dive into this. First and foremost, keeping your body warm is integral. This is especially true for those with poor circulation, as they are more susceptible to developing chilblains. Dressing in layers is a great way to trap that essential body heat. Starting with thermal underwear, followed by regular clothes, then a sweater or coat, and finally a waterproof or wind-resistant layer if you're going to be outside in harsh conditions. Equally important is protecting your extremities. Wear thick socks and insulated gloves or mittens to keep your fingers and toes cozy. And let's not forget about our heads and necks, which can lose a significant amount of body heat if not covered. A hat and a scarf can be your best friends during the cold months. Besides dressing appropriately, it's essential to keep your living environment warm as well. Use heating devices in your home or office to maintain a comfortable temperature. But remember, sudden changes in temperature can trigger chilblains. So, avoid jumping from a hot room to a cold one or vice versa. Another essential aspect of prevention is maintaining good circulation. Regular exercise can help with this. It doesn't have to be anything strenuous. Simple activities like walking or doing household chores can get your blood flowing and keep your body warm. Hydration and nutrition also play a role in preventing chilblains. Staying hydrated helps improve blood flow, while a balanced diet ensures your body gets the nutrients it needs to function properly. Include foods rich in vitamins B, E, and C, as they are known to improve circulation. Lastly, quit smoking if you do. Nicotine constricts blood vessels, which can lead to poor circulation and increase the risk for chilblains. In short, keep warm, exercise regularly, eat a balanced diet, stay hydrated, and avoid smoking. These measures can significantly reduce your risk of developing chilblains. And if you do get chilblains, there are treatments available. But remember, it's always easier to prevent a problem than to treat it, so stay warm, stay healthy. Got chilblains? No worries, there are ways to treat them. Now let's talk about those solutions, shall we? First off, when you discover you have chilblains, it's crucial to keep the affected area warm. But remember, don't expose your skin directly to heat. Instead, use gradual warming techniques. You might be tempted to stick those chilly toes in front of a heater, but that can actually worsen the condition. Now, on to the treatments. Chilblains can be quite itchy, but scratching can lead to infection. To relieve this itchiness, there are several creams and lotions available over the counter. These products often contain ingredients like calamine or witch hazel, which soothe and cool the skin. If the itching persists, a corticosteroid cream might be your next line of defense. This type of cream reduces inflammation and can help alleviate the itch. But remember, these creams should be used sparingly and under the guidance of a healthcare professional. For those stubborn chilblains that don't seem to improve with creams or lotions, Medications to improve circulation may be recommended. Nifedipine, a type of medication that helps dilate the blood vessels, is commonly used. This can help improve blood flow to the affected areas, reducing the symptoms of chilblains. In some cases, your doctor might suggest a procedure called sympathectomy. It's a minor surgery that can help if your chilblains are severe or recurrent. This procedure interrupts the nerves that signal the blood vessels to narrow, which can prevent chilblains from developing. While we've covered several treatment options, the best course of action may vary depending on your specific situation. You could need a combination of these treatments or something entirely different. And that's why it's so important to consult with a healthcare provider if you suspect you have chilblains. They can assess your condition, provide appropriate treatment, and offer advice on how to prevent future episodes. So while chilblains can be an uncomfortable nuisance, remember that there are treatments available and professionals ready to help. Remember, if you have chilblains, it's important to see a doctor. Chilblains might sound scary, but they're manageable. Yes, this is where we've arrived after our journey through the world of chilblains. Let's take a brief walk down memory lane. We've learned that chilblains are small, itchy swellings on the skin that occur as a reaction to cold temperatures. We've discovered that they're often caused by poor circulation and can be exacerbated by sudden changes from cold to warm environments. We've also explored the best ways to prevent chilblains. Remember, bundling up in cold weather is your first line of defense. Keep your extremities warm with gloves, thick socks, and insulated shoes. At home, maintain a comfortable, steady temperature and avoid exposing your skin to drastic temperature changes. Treatment-wise, we've delved into the importance of warming the skin gently, using topical creams to alleviate symptoms, and seeking medical advice for severe cases. Over-the-counter creams can help soothe the itchiness. But if your chilblains don't improve after a week, don't hesitate to consult a healthcare professional. If you suspect that you or a loved one has chilblains, remember, it's essential to seek medical advice. While chilblains are often harmless and clear up on their own, they can sometimes be a sign of more serious underlying conditions, so don't take any chances. Thank you for watching. Remember, staying warm is key to preventing chilblains. Let's face it, no one likes itchy, sore skin. So stay cozy, stay warm, and keep those chilblains at bay.